Welcome to the Joey Becker podcast here. Thank you for listening. Today, I am speaking with Dr. Ajay Bhatnagar, a radiation oncologist from Phoenix, Arizona that I connected with on LinkedIn. I reached out to him as part of my physician referral network, talked about his story on a few phone calls, got to know him. I was really inspired. He's doing something very different in the medical field than a lot of more conformists, I think, and it's just thinking outside the box, kind of trying to break the norm a little bit and adding value to his patients. So I thought it'd be really fun to chat with him, help spread his message, share it with my community. So I'm going to jump in and I'll let Dr. Bhatnagar introduce himself.
My name's Ajay Bhatnagar. I'm a board certified radiation oncologist practicing currently in Phoenix metro region. I was originally born in London, England, and I grew up in the East Coast. Grew up in the Philadelphia area. I actually went to college at University of Pennsylvania, where I studied biomedical engineering. And then I went to medical school at the University of Pittsburgh, where I stayed on for my radiation oncology residency, as well as my MBA. But I was tired of cold weather, wanted to be in some nicer, warmer weather, play some golf. And so I've been in Phoenix area since 2007. I was in a traditional radiation oncology practice from 2007 till about last year, where I started a brand new, unique practice focusing on a very niche specific treatment that is called low dose rate brachytherapy that is used to treat men with localized prostate cancer.
When did you get introduced to LDR brachytherapy?
Excellent question. I actually got introduced to that as a medical student. I was a third year medical student at Pittsburgh, and I got to go to the operating room and observe this procedure by one of the doctors. I instantly fell in love with the specialty. And during my residency training, I continued to get exposure and training in this procedure. As soon as I came out into practice, I immediately implemented it.
Awesome. So what kind of drew you or what kind of intrigued you about LDR? What are the benefits to the patient? What did you think about this procedure that you saw?
Yes. So LDR prostate brachytherapy is actually the most conformal radiation treatment for prostate cancer. It is, though, highly operator dependent. When done correctly, using modern techniques that I can explain further, the outcomes can be excellent. This is a one-time procedure that is done in less than an hour. You go home the same day. Patients are completely done with their treatment with minimal downtime, minimal side effects, and there really is no other treatment like that. This traditional external beam radiation treatment is anywhere from 4 to 8 weeks of radiation treatment that many men don't really want to deal with. And so here is a great alternative that is done in less than an hour.
Tell me about the normal or mainstream treatment for prostate cancer, be prostatectomy, and how does that compare to LDR brachytherapy?
Yeah, I mean, prostatectomy is still the standard treatment for many men, especially the younger men. But as you get older, the prostatectomy can have potentially significant side effects, such as incontinence and impotence. Therefore, the low dose rate brachytherapy is a great alternative to surgery, especially for these older men, where there is really no risk of incontinence. And in terms of impotence, LDR brachytherapy actually has the best erectile function preservation rates compared to prostatectomy or external beam radiation, being that it's so conformal, that it really has minimal dose to the surrounding nerves, and that's why it's able to preserve erectile function.
Mm-hmm. Gotcha. And why wouldn't more people do LDR versus a prostatectomy? Why isn't that more mainstream, you think?
Yeah, excellent question. And what I tell people is that the story of LDR brachytherapy represents exactly what's wrong with our healthcare system today. Here you have a very cost-effective treatment, but has gone by the wayside due to the more lucrative treatments that have been available that are now, may have heard these terms such as, IMRT or proton beam therapy or robotic prostatectomy, which are all much more lucrative than the LDR brachytherapy, which is again, the most cost-effective treatment, as well as the most conformal radiation treatment. And if you look into other areas around the world, especially where there's socialized medicine, such as Canada, the utilization of LDR brachytherapy is much higher, much more common in those regions. But here, it's gone away, which is fairly sad. But yet the reason why I've decided to, bring this to start this practice to help revive this treatment that's needed for our patients. The other issue now is that since it's gone away, there's very few people trained in this procedure. It's not something that you can just learn over a weekend course or just learn overnight. I mean, this does take years of training, and it is highly dependent on the operator. There needs to be a certain skill set and knowledge and experience to do this treatment properly, or else there are bad complications that can occur when not done correctly. So, given that intimidation, it's hard for someone to start doing this treatment, when they're already in practice and already doing other treatments, especially that are more lucrative. So why would you want to do this?
Mm-hmm. And so what's the current state of LDR brachytherapy in Arizona, Phoenix? Are you seeing urologists working with it, or?
There's been a slow interest in it getting there. It's always hard to break referral patterns. People are inherently resistant to change, but people do recognize the importance of this treatment, especially as patients are asking more about it. Again, a lot of people still have equity interest in radiation centers that offer IMRT, and therefore, urologists or radiation oncologists that are affiliated with such radiation centers tend to refer for that treatment rather than LDR brachytherapy, since it's fairly capital intensive to have a radiation center. A significant cost involved. Therefore, that can influence referral patterns.
So then, we already kind of touched on it, but urologists are kind of the biggest collaborators for you with this type of procedure. Who else are kind of part of that?
There is an ability to actually perform this procedure in collaboration with urologists. So I often have urologists, both of us in the operating room at some point, doing the procedure together. That definitely makes this procedure more intriguing and attractive for urologists, since they are able to participate in this procedure clinically and be able to, bill CPT codes for this procedure. And therefore, it is not only a benefit for the patients to have this, but also beneficial for the providers to provide this. There is minimal costs involved with this treatment. So to start a brachytherapy program is not like starting a radiation center program. The costs are beyond just a fraction of cost of that, and therefore it becomes something quite easy. It's really more the technical skill set of knowing how to perform this procedure that can actually be maybe the biggest stumbling block.
Mm-hmm. So tell me a little bit more about the benefits to a urologist, because I know we've talked a little bit and you said, time, prostatectomy versus LDR. We talked about CPT code, practice management, really. What are the benefits to them for using this type of procedure?
Yeah. So first of all, there is a fairly generous CPT code that they're able to bill for this, 55875. And there is also rectal spacing that can also be performed, which is 55874. And the time involved for the procedure can range from anywhere for the procedures, less than 30 minutes, and their participation is varied among who I work with, and that compared to doing a 4-hour robotic prostatectomy makes this from a time cost benefit much more lucrative, actually. It also can be done concurrently. Urologists can have multiple operating rooms running simultaneously, and this can be one of their procedures while performing other procedures. So it's a very good use of their time.
Mm-hmm. And you're typically the one in there performing their procedures.
Correct. Yes, I'm in there, and then urologists come in there for their part, and therefore able to have multiple procedures going concurrently with this treatment, since this is done collaboratively with radiation oncologists such as myself.
Mm-hmm. And so you mentioned referral networks, but what are kind of the biggest challenges, for patients getting this type of service?
Yeah, there's very few people that provide this service because of not only now the financial benefits of other treatments, but also now the limited capability and skill set and experience of most providers now. And so there's just a handful of people that actually now are able to perform this procedure competently. And that's really probably the biggest difficulty of having access to this treatment, of finding competent and radiation oncologists or urologists that are actively performing this. Again, this is a treatment that you want to be actively performing. It's not something you want to do just once in a while, given the skill set required to perform this procedure. You want to be able to go to a active program where they're constantly treating patients with this procedure to have the best outcomes.
Mm-hmm. So how are you overcoming the challenges with breaking the referral networks, with getting this procedure to patients?
Yeah, using a multi-pronged approach. I am going directly to patients using various marketing efforts, whether it's social media or TV, and it's also working with urologists that are interested in offering this treatment to their patients. And it's slowly working. I mean, nothing happens overnight, but I could say, over the past year, since it's only been a year, that I've actually not even a year, technically June 1st, 2022 is when I officially started my practice. That's called Prostate Cancer Institute of Arizona. And so, when you look at it from that perspective, yeah, it's been adopted by several physicians in this region, offering it to a handful of patients. And I look forward to it growing even further.
Mm-hmm. So when you're connecting with urologists and other physicians, obviously there's some people that are like, nope, not doing it, no interest. What are some of the biggest objections to this type of treatment that you're seeing?
There could be a preconceived notion that this treatment is antiquated and outdated and doesn't provide good outcomes. And that's not really true when done in the hands of proficient brachytherapists. And then, for others that have a bias towards the current treatment that they offer for various reasons. Mm-hmm. And so, they're set, like I said, it's people are inherently resistant to change. And so I understand that, especially, when they have made significant investments, such as building a radiation center to offer IMRT, that will, need to become their major source of referrals because there are significant costs with running one of those centers. And therefore, in order to have a return on their investment, the referral pattern has to be driven that way. So I understand, but not everyone is tied to a radiation center, and therefore those urologists that are not tied to one tend to be more interested or more open to the idea of adopting this treatment.
And you just kind of touched on it, but I was going to ask you, a lot of urology groups sometimes will have a radiation oncologist on staff. So, that's kind of hard to break into versus maybe a smaller private practice urologist would make more sense for you to connect with.
Correct. And even though there are some urologists that work with a radiation oncologist for external beam therapy, there's now very good data to support the combination of brachytherapy and external beam radiation for many patients with more aggressive disease. And therefore, it's reasonable to offer both treatments.
Anything else that you wanted to chat about for LDR brachytherapy, the benefits to the patient?
Yes, I mean, it is definitely an excellent treatment option for patients with localized prostate cancer, but also there are new exciting developments for this treatment where we can use enhanced imaging to offer focal therapy. Focal therapy for prostate cancer is a very emerging field where only a part of the prostate is treated in an effort to minimize side effects while adequately treating the tumor. And with enhanced imaging and diagnostic techniques, we are now being able to identify these patients that could be amenable to such a treatment. And there are other technologies to do focal therapy, but if anyone sees what LDR brachytherapy can do, it really is the ultimate modality for focal therapy. It's given its conformality. So it's an ideal treatment for focal therapy, which could be the future for prostate cancer.
Awesome. So I have a couple of questions to wrap up here, and we'll finish up here. Okay, so one question that I want to ask is, so if you can think of a patient that kind of had an impact on you or kind of touched your heart as a radiation oncologist, wanted to see if you had a story that you could share.
Recently, I had a patient who actually had another cancer where he received radiation to the pelvic region, and he was successfully cured by that. But now developed prostate cancer. And so he was no longer a candidate for additional external beam radiation, given the prior radiation, but we were now able to successfully cure him with LDR brachytherapy without exposing his previously irradiated organs to excessive radiation, and resulting in a very successful outcome and allowing him to continue to work in his very important job. And the patient was very thankful, unfortunately experiencing two malignancies in the same year, then having the fortunate outcome of receiving two successful treatments while still maintaining his quality of life. So that was very satisfying and comforting to see that.
Yeah. And I probably should have asked this earlier, but who are your typical patients that you're treating then?
Yeah, typically they are patients that have been diagnosed with localized prostate cancer, or they just confined to the prostate. Tend to be above 65 and older, but they can be younger if they're interested. And another candidate are for patients who have failed external beam radiation. LDR brachytherapy is actually an excellent salvage treatment for the men who have failed external beam treatment. And a lot of times these men are very disappointed after failing this external beam radiation, as they've heard that surgery could be quite drastic for these men, because removing an irradiated prostate is not that easy, leaving significant side effects. And therefore, LDR brachytherapy is a great alternative to salvaging these men that have failed external beam, and it has led to excellent results. And like I said, men with high-risk prostate cancer who have more aggressive disease, the combination of brachytherapy and external beam radiation, along with hormone treatments, is actually a very high cure rate, which you previously used to have a very low cure rate. But now, these men can be successfully cured with nearly a 92% cure rate. That used to be the 70% range. These men with at least a 9 or 10 cancer.
Wow. That's awesome.
Yeah, I mean, the ability to give really high dose in that area with the ability to spare the surrounding critical structures, such as the bladder and the rectum, is really only possible done with, brachytherapy.
Mm-hmm. So I wanted to ask you, what's something you think is misunderstood about radiation oncologists or your profession?
That's an excellent question. I think there's a misconception that radiation oncologists are radiation therapists, and we just sit at the computer, pushing a button, turning on the radiation beam, and really don't really talk to patients. But I can tell you, my specific area is very patient oriented. I'm constantly counseling the patient, informing the patients, and then I go to the operating room and performing operative procedures with this patient, where I'm implanting needles through the perineum, injecting the radioactive seeds through the prostate. So I'm actively doing something, not just sort of sitting behind some computer pushing buttons.
Yeah. Do you think you will be outside of Arizona? Are you just focusing on covering the entire state at this point?
No, I think I would like to cover as many areas as possible, especially where there is an interest. If anywhere where there is an interest in providing this treatment, I'm more than happy to look into collaborating and offering this treatment to that community. Mm-hmm. I really believe that this should be offered to our community, really for the patients to benefit from this, and really for everyone to benefit from this.
Mm-hmm. So tying into that, so if you could do anything to improve healthcare in rural America, what would you change, or what would you do?
Yeah, I think, in rural America, there is a limited access to modern care, especially modern cancer care. Mm-hmm. And so something like this, LDR brachytherapy, is an ideal option for rural America, because they don't need to travel multiple visits like they would have to for standard radiation. And these patients tend to have to travel every day for 1 to 2 months, significant miles, whereas, undergoing this single one-time procedure would eliminate that, being highly valuable for these patients living in rural areas. I currently perform it in a rural area, and patients are highly appreciative.
Yeah. Yeah, you'll do a teleconsultation.
Yeah, I perform. I mean, I originally also practiced in Casa Grande, where I had a traditional cancer center practice, but I still now perform the procedure in Casa Grande for those patients. I just see those patients either virtually or preoperatively and postoperatively, but then perform the procedure in their local hospital. And these patients are very appreciative and greatly benefit from this treatment rather than having to commute all the time.
Mhm.
There's a significant time and costs involving commute that can take a lot of, impact on their quality of life. They have to, cancel their vacations or cancel their grandfather or their grandson's wedding or their granddaughter's graduation because they're undergoing radiation. And so this treatment allows them to not have to sacrifice their quality of life for their health.
Mm-hmm. Yeah. Awesome. So, everybody has days where you're like, what am I doing here? What's my mission? What continues to inspire you, through this journey of, the Prostate Cancer Institute of Arizona?
Yeah, like I said, I am deeply inspired to revive this treatment modality that has gone away for the wrong reasons. And I really want to make this available to all the patients that are interested in having this treatment. And that is my new mission for this practice, not just in Arizona, but throughout the country, because this is an option that should be available for anyone that is interested in it.
All right. So I have two selfish questions I want to ask you.
Okay.
So one is, what is an underrated health tip that is easy to implement that you would recommend?
Underrated health tip would be to get enough sleep every day. 8 hours.
Mm-hmm.
That would be, I think, beneficial for their physical and mental health beyond their comprehension.
Mm-hmm. Awesome.
You said one, so that's why we're going to stick to one.
Yeah, we'll stick to one. That's fine. If you have more, you can share.
That's okay.
Okay, we'll stick to one. And then I'm an avid reader. I love reading, nonfiction, self-help books. Do you have any book recommendations?
Oh yeah, there's a lot of great books out there. Specifically, I like this book called Anti-Cancer Living by Professor Cohen. He's actually the integrative oncologist at MD Anderson, and he goes through a lot of all the sort of evidence-based practices that patients, lay people can do themselves that they have control over. There's 6 major areas that they can do that can have significant impact on their cancer outcome. And that's important. And he goes through it really well. So it's called Anti-Cancer Living.
Awesome. Great. Well, I think that's about all the questions I have. So if people want to learn more about you, what's the easiest way to, learn about you and follow your journey?
Yeah, my website is really good, pciaz.org or prostatecancerinstituteaz.com. They can get a hold of me there on my website, my phone number, email. I also have a Facebook page. Mm-hmm. So I'm easy to get a hold of.
Okay. And what's the best way for the community that hears this to help you out?
The best way for them is to, contact me and approach me and of how they would be able to offer this treatment for their community. Just reach out.
Awesome.
I'll be glad to help,
Thank you for listening to the whole episode with Dr. Ajay Bhatnagar of the Prostate Cancer Institute of Arizona. Thank you for listening. I really enjoyed speaking with him. I hope you got some value from this. Please share this with anybody that you think this would also bring value to. I look forward to sharing more podcast episodes in the future. Thank you again. If you want to learn more or see other podcast episodes, you can find them at thinkprosocial.com, THINK, pro, PRO, social, SOCIAL.com. And I look forward to seeing you again soon. Thank you.